Okay, welcome back to the deep dive.
Great to be back.
So today we're really digging into a topic based on some fascinating sources you shared with us.
That's right. All about streptococcal infections, strep in dogs and cats.
Yeah, and our plan is to sort of unpack all this information, pull out the really key things you need to know without getting totally bogged down in the technical jargon.
Exactly. We want you to come away feeling well-informed about something that honestly has some surprising twists and turns.
Definitely. We'll cover, what these bacteria actually are, how they can sometimes be harmless, other times not so harmless.
Right. And what the signs look like, how vets figure it out, treatment, outcomes.
And importantly, that connection to human health, which I found really interesting in the materials.
Yeah, that's a key part. It's a dive into bacteria that are, well, pretty common, but can cause anything from a minor issue to something incredibly serious.
Okay, let's jump right in. First things first, what are streptococcal bacteria, fundamentally?
Okay, so at the most basic level, they're tiny organisms, bacteria. Specifically, they're spherical cells called cuci.
Kochi, like little balls.
Exactly. And under a microscope, you often see them lined up maybe in pairs or more typically in chains, like tiny strings of beads. They're also gram-positive, which is just a lab classification based on how they stain.
Okay, chains of little spheres. Got it.
And here's a really important point. Often they're just there. They're part of the normal healthy mix of bacteria, what we call commensal organisms.
Commensal, meaning they just live alongside the host.
Pretty much in places like the mouth, the throat, up in the respiratory tract, on the skin, even the lower genital tract, without causing any problems at all.
That seems weird for something that causes infections, doesn't it? Living there normally.
It does, but that's the key thing. They're opportunistic. They live in balance most of the time, but if the conditions are right, if there's an opportunity,
They take it.
they take it. And they can potentially cause infection almost anywhere in the body.
So what makes them switch from, harmless roommate to problem tenant? And are there different kinds we should know about?
Good questions. Yes, there are many types, and they get classified in a few ways. One is how they break down red blood cells in a lab test, that's hemolysis. Beta hemolytic ones, the ones that cause clear zones, tend to be more pathogenic, more likely to cause disease.
Okay, beta hemolytic sounds more aggressive.
Generally, yeah. And then there's another system based on sugars in their cell walls, the Lancefield groups, like Group A, Group B, Group G, and so on.
Right, I saw Group G mentioned a lot for pets.
Exactly. Group G is strongly associated with the most common species we see causing trouble in dogs and cats, which is Streptococcus canis, or S. canis for short.
S. canis. And that's the one that's usually living harmlessly in the mouth and skin.
That's the one. Lancefield Group G, usually beta hemolytic. It's the prime suspect in most routine strep infections in pets. Lives there normally until things change.
Okay, S. canis is the common one. But the sources also mentioned another one sounded much scarier.
Ah, yes. You're probably thinking of Streptococcus equisius subspecies zooepidemicus.
That's a mouthful.
It is. Often called S. zooepidemicus or just zoo. It's less common overall than S. canis, but when it hits, it can be devastating.
How so?
It's known for causing really severe, highly contagious disease, and unfortunately, it's often fatal.
Wow. Contagious and fatal.
Yeah, it's particularly linked to outbreaks of severe hemorrhagic pneumonia that's bleeding in the lungs, especially in dogs, and it spreads rapidly in places like shelters or kennels. A really serious one.
Yikes. Okay, so S. canis common, S. zooepidemicus, dangerous, but less common. What about other types? Like, can my dog give me strep throat? Or vice versa?
That's a common question. You can find other strep groups sometimes, like A, B, or C, but Streptococcus pyogenes, that's the group A strep, the main cause of human strep throat, it very rarely causes primary illness in pets.
So my dog probably isn't the source if I get strep throat.
Highly unlikely. And pets generally aren't considered a significant reservoir for human strep throat.
Good to know. So back to these bacteria being opportunistic.
Yeah.
You said they have tools to cause infection.
Right, virulence factors. Think of them as their weapons. They produce toxins like streptolysins that damage host cells. They have enzymes like streptokinases and hyaluronatases that help them break down tissue barriers and spread through the body.
Sounds nasty.
And they have ways to stick really tightly to the host's tissues, called adhesions. It all helps them evade the immune system, and cause damage.
So what gives them the opening? What weakens the pet's defenses?
There are several key scenarios. A big one is a compromised immune system. This is really critical for the very young animals, like newborn puppies and kittens.
Especially if the mother is a first-time mom.
Exactly. They might not pass on as many protective antibodies. Also, very old pets or animals whose immune systems are suppressed for other reasons.
Like what?
Diseases like feline immunodeficiency virus, FIV, or feline leukemia virus, FLLV, in cats, or Cushing's disease. Even certain medications, especially corticosteroids used long-term, can weaken the immune response and make pets more vulnerable.
So their internal defenses are down. What else?
Physical barriers are huge. If the skin gets broken, that's a direct route in.
Like bites or scratches?
Yep, or surgical wounds or any kind of trauma. But also chronic skin problems, think pets with really bad allergies constantly scratching, or even heavy parasite infestations like fleas or mites causing skin damage. It breaches that protective layer.
Makes sense. The shield is down.
Precisely. And then there's underlying inflammation or disease. If a pet already has, say, chronic sinusitis or bad dental disease or a persistent ear infection.
Ah, so an area that's already kind of inflamed or unhealthy?
Right. It creates a favorable environment for the strep that might already be living there to overgrow and turn pathogenic.
And the sources mentioned other infections playing a role.
Yes, co-infections. If a dog, for instance, gets canine influenza virus, their respiratory tract is already inflamed and weakened, making it much easier for strep to then cause a secondary, and often more severe, pneumonia.
So it kicks them when they're down, basically.
That's a good way to put it.
Can a pet just carry these bacteria, maybe S. canis, without any signs? Like be a silent carrier?
Oh, absolutely. A carrier state is definitely recognized. The bacteria are part of their normal flora. They're perfectly healthy until one of those predisposing factors we talked about tips the balance.
Okay, this leads to something really complex that jumped out from the research notes, the idea of bacterial superantigens.
Ah, yes. That's a really important concept for understanding the most severe forms of strep infections.
Superantigens. Sounds dramatic.
They are. Some strep strains produce these incredibly potent toxins called superantigens. What they do is essentially short-circuit the immune system. They trigger a massive, uncontrolled activation of immune cells, leading to a huge storm of inflammation throughout the body. It's not a targeted response anymore, it's just chaos. This is thought to be the mechanism behind the multi-organ failure you see in things like streptococcal toxic shock syndrome or necrotizing fasciitis.
So the bacteria basically trick the body into attacking itself systemically.
In a way, yes. It's an overwhelming, dysregulated immune response caused by the toxin. And interestingly, the sources mentioned a potential connection being investigated.
With an antibiotic.
Yeah.
Enrofloxacin.
Exactly. There's a hypothesis, and it's still being researched, that in certain situations, using enrofloxacin might inadvertently trigger bacteriophages. These are viruses that live inside bacteria, and triggering these phages could potentially lead the strep bacteria to produce more of these superantigen toxins.
Wow. So a drug meant to kill the bacteria might, through this complex interaction with viruses inside the bacteria, possibly make things worse in terms of toxin production.
Yeah, it's complex. It's incredibly complex, and it's not saying don't use the antibiotic, but it highlights just how intricate these interactions are between bacteria, viruses within them, the host immune system, and the treatments we use. It's an active area of research.
Okay, so we have these opportunistic bacteria armed with virulence factors, maybe even superantigens, ready to strike when defenses are down. What does an infection actually look like? What signs should you watch for in your pet?
Well, as you can probably guess by now, it really runs the gamut. The signs depend entirely on where the infection is and how severe it gets.
Are there any general clues? Like if it's more serious?
Yeah, if it's becoming more systemic, you might see general signs of illness lethargy, just not acting right, maybe a fever, not wanting to eat. But often the signs are more localized, at least initially.
Okay, like on the skin.
Right. Skin and soft tissue infections are common. You might see an abscess, which is like a contained pocket of pus, or cellulitis, where the inflammation is more spread out in the tissues under the skin, causing redness, swelling, heat, and pain.
And then there's the really scary one.
Necrotizing fasciitis or myositis, the so-called flesh-eating disease. Thankfully rare, but absolutely devastating.
What makes it so bad?
It progresses incredibly fast. You see severe pain, often seemingly way worse than the visible lesion looks initially. Rapidly spreading swelling, the skin can change color, get purplish or black, maybe blister, and the tissue underneath is dying. Plus, the pet is usually profoundly sick systemically. It's a true surgical and medical emergency.
Okay, moving on from skin. What about breathing problems?
Respiratory infections are also pretty common. Could be an upper respiratory thing, nasal discharge, sneezing, maybe some coughing, sore throat, inflamed tonsils, or it can go deeper into the lungs, causing pneumonia.
And that S, zooepidemicus, causes a bad pneumonia.
Yes, that's the one linked to the severe hemorrhagic kind. Lots of coughing, difficulty breathing, often with a bloody discharge. Very serious.
What if the bacteria get into the bloodstream? That sounds really bad.
It is. That's when you get into systemic or invasive disease. In newborns, you can see neonatal septicemia.
Septicemia, blood poisoning.
Essentially, yes. Bacteria multiplying in the blood. In neonates, it's often overwhelming and leads to sudden death. Sometimes it's traced back to the mother carrying the bacteria.
And in older animals?
You can get bacteremia, bacteria in the blood leading to sepsis. That's a body-wide inflammatory response to the infection. Fever, lethargy, rapid heart rate, difficulty breathing, and potentially organ dysfunction. And then there's the rarest but most severe systemic form, streptococcal toxic shock syndrome, or STSS.
Driven by those superantigens.
Exactly. Sudden onset of shock, collapse, widespread organ failure, often problems with blood clotting, extremely high fatality rate.
It really seems like almost any part of the body can be affected.
It's true. The sources list quite a range. You can see musculoskeletal infections like arthritis, painful joints, discus spondylitis, infection of the spinal vertebrae and discs causing severe back pain, or osteomyelitis, infection in the bone itself.
What about down there, urogenital?
Yep. Urinary tract infection,
Yeah.
UTIs like cystitis, bladder infection, or pyelonephritis, kidney infection. Also, reproductive tract issues. Metritis, uterine infection after birth. Vaginitis, infections in males like orchitis, testicles, or epididymitis, can even affect fertility, cause pyometra, pus-filled uterus, or abortions.
Wow. The list just keeps going.
It does. Also, ocular problems like conjunctivitis or keratitis, cornea otitis, ear infections. Less commonly, endocarditis, infection of heart valves, even meningitis or meningoencephalitis, inflammation of the brain and its linings. And it's often implicated in fading puppy or fading kitten syndrome. Plus, simple wound infections after a bite or surgery are common too.
Okay, so literally from an itchy ear to a catastrophic systemic failure, that's a huge spectrum. So how does a vet actually diagnose this? How do they pinpoint strep amid all these possibilities?
It's definitely a combination approach. It starts with suspicion based on the clinical signs and the pet's history. Are there wounds, underlying conditions, recent exposure? The physical exam findings are obviously key.
And then test.
Often, yes. A vet might start with cytology. They'll take a sample, maybe pus from an abscess, discharge from the ear or nose, fluid from a joint, put it on a slide, stain it, and look under the microscope.
Looking for those chains of Kachi.
Exactly. Seeing gram-positive Kachi, especially in chains, is highly suggestive of strep. It's a quick in-house clue.
But that's not definitive, right?
Not always definitive to the species level, and it doesn't tell you about antibiotics. For that, the gold standard is bacterial culture and sensitivity, the CNS.
That's where you grow the bacteria.
Right. You need a sterile sample collected properly from the site of infection. Could be a deep tissue sample, a swab from deep within a wound, not just the surface, fluid tapped from a joint or the chest, urine collected sterilely, or even a blood culture if sepsis is suspected.
And the S part, sensitivity, is crucial.
Absolutely vital. The lab grows the bacteria and then tests various antibiotics against it to see which ones actually kill that specific strain. This is essential for choosing the right drug.
Even though you said many strep are sensitive to common drugs.
Yes, because you never know for sure without testing. Resistance can occur, though maybe less frequently than with staph. And for severe infections or infections not responding to initial treatment, you absolutely need that sensitivity data to guide therapy effectively.
What other tests might be run?
Standard blood work is very common. A complete blood count, CBC, looks at red cells, white cells, platelets. It can show signs of inflammation or infection like high white blood cells, sometimes anemia or low platelets in severe cases.
And chemistry.
Blood chemistry panels assess organ function, liver, kidneys, and can also show markers of inflammation or dehydration. If a UTI is suspected, urinalysis looks for white blood cells, red blood cells, and bacteria in the urine.
Imaging too, I suppose.
Definitely. X-rays, radiographs, are crucial for looking at the lungs for pneumonia or checking bones for osteomyelitis or discus spondylitis. Ultrasound is great for looking at soft tissues, finding abscesses, examining abdominal organs, or checking the heart.
And the heart specifically.
If endocarditis is suspected, an echocardiogram, which is an ultrasound of the heart, is needed. And sometimes, especially for rapid identification, PCR tests can be used. These detect the bacteria's genetic material.
Okay, so it's a thorough workup. Once strep is confirmed, what's the game plan for treatment?
Treatment really boils down to two main things: targeted antibiotic therapy and good supportive care.
And the antibiotics are ideally chosen based on that CNS test.
Ideally, yes. The good news, as highlighted in the sources, is that most strep relevant to pets S. canis, even the dangerous S. zooepidemicus, tend to be quite susceptible to beta-lactam antibiotics.
Which includes penicillin.
Exactly. Penicillins like penicillin G, penicillin V, or amoxicillin are often first-line choices. They work well, they're generally safe, and readily available.
What else falls in that category?
First-generation cephalosporins like cefalexin or cefazolin are also excellent choices. And amoxicillin combined with clavulanate like Clavamox is another highly effective beta-lactam option frequently used.
Are there backups if those can't be used or aren't effective?
Yes, the sources mentioned others like erythromycin or clindamycin as potential options depending on the situation, and ideally the sensitivity results. But the beta-lactams are really the workhorses for strep.
You keep mentioning the sensitivity test, even with these reliable drugs.
It's just good practice, especially because resistance can happen, and in severe or non-responsive cases, you don't want to be guessing. You need confirmation you're using something effective.
How long does treatment usually last?
Big variation here. For a straightforward acute skin infection, maybe 7 to 14 days. But for deeper, more chronic infections like those bone or spine infections, osteomyelitis or discus spondylitis, you're looking at much longer courses, often 4 to 8 weeks, sometimes even longer, potentially even after the pet seems clinically normal, just to be sure it's fully cleared.
Wow, that's a commitment. And you said supportive care is just as important.
Absolutely critical, especially for the sicker animals. This can involve intravenous IV fluids if they're dehydrated or in shock. Effective pain management could be NSAIDs or stronger opioids, depending on the pain level.
And for skin stuff.
Meticulous wound management. That might mean surgically cleaning up the wound, debridement, draining abscesses, bandaging, keeping it clean. Also, nutritional support if they aren't eating, maybe oxygen therapy for pneumonia, and crucially, addressing any underlying conditions that predispose them to the infection in the first place.
Right, because if you don't fix the underlying issue,
It's likely to come back.
what about those really extreme cases like necrotizing fasciitis or toxic shock?
Those require aggressive, intensive critical care, usually in a hospital setting. We're talking IV fluids, often very high rates, potent, broad-spectrum IV antibiotics, maybe multiple ones started immediately while waiting for culture results because time is critical. And for necrotizing fasciitis, aggressive surgical debridement to remove all the dead and infected tissue is often life-saving.
Anything vets should specifically avoid using?
Well, generally avoiding immunosuppressive drugs like high-dose steroids makes sense, as you don't want to further weaken the immune system that's trying to fight the infection.
Makes sense.
And there was that specific note about potentially using prophylactic antibiotics in newborn kittens from first-time moms if neonatal strep sepsis is a known issue in that environment.
Okay, so treatment depends heavily on the specifics.
Yeah.
What about the outcome? What's the prognosis typically like?
Again, it really mirrors the spectrum of the disease. For the more common, localized, superficial stuff like a mild skin infection, an uncomplicated UTI if it's caught reasonably early, treated appropriately with the right antibiotic, and any underlying factors are managed, the prognosis is generally good to excellent.
That's encouraging for most cases.
It is, but for those severe invasive syndromes, the necrotizing fasciitis, the STSS, severe hemorrhagic pneumonia, endocarditis, meningitis, overwhelming sepsis, the prognosis shifts dramatically to guarded to poor.
Even with that aggressive treatment.
Even with aggressive treatment. These conditions unfortunately carry very high morbidity, meaning severe illness and mortality rates. They are incredibly challenging.
So the deeper and more systemic it gets, the worse the odds.
That's a fair summary. And remember, the long-term prognosis also really depends on whether those underlying predisposing factors can be controlled. If not, recurrence is a real risk.
Okay, this brings us to a really important question, probably on the mind of anyone listening who has pets. Can people catch strep from their dog or cat? What's the zoonotic potential?
This is a super important point, and the understanding here has evolved. For a long time, the general feeling was that the risk was pretty low. Most of the strep species typically found in pets weren't considered major threats to healthy humans.
But that's changing. I picked that up from the notes.
It is, and this is a really key takeaway from the sources. S. canis, remember, the most common species causing pet infections, is now recognized as an emerging zoonotic agent.
Emerging zoonotic agent, meaning it can jump from pets to people and make them sick.
Yes, that's exactly what it means.
Yeah.
There are documented cases now from various parts of the world where humans have become infected with S. canis.
What kind of infections do people get?
It can range. Skin and soft tissue infections are reported, but also more serious things like bacteremia, bacteria in the bloodstream, endocarditis, which is infection of the heart valves, and even life-threatening septicemia.
And how do people usually get exposed?
The reports often link these human infections to close contact with an infected pet. This could be direct contact with pus or drainage from a wound, but also potentially through dog bites or scratches, or maybe even just very close handling of a pet that has an active severe S. canis infection.
So it's not just casual contact with a healthy pet.
Generally not. It seems more associated with exposure to an active infection site or fluids. And importantly, the sources suggest the true number of human S. canis cases might be underestimated. It could be happening more often than currently recognized.
Okay, so the risk isn't zero, especially if your pet is sick with strep. What about the other way around, human strep throat affecting pets?
As we touched on earlier, the sources confirm that S. pyogenes, the human strep throat bug, rarely causes clinical illness in pets, and pets are generally not seen as a significant source for spreading human strep throat. So, you getting strep throat from your cat is highly unlikely.
Okay, that's reassuring.
Yeah.
Given this emerging risk from S. canis, especially from sick pets, what practical advice can we give people to stay safe?
The sources outline some really clear, common-sense precautions. Top of the list, strict hand hygiene. Wash your hands thoroughly with soap and water after handling your pet, especially if they have any wounds, skin infections, or discharge.
Simple but effective.
Absolutely. Also, if you are cleaning a pet's wound or applying topical medications, wearing disposable gloves is a very good idea.
What else?
Try to keep any open wounds on your pet covered, if practical, to minimize environmental contamination and direct contact. And try to prevent your pet from licking your skin, especially if you have any cuts, scratches, or broken skin yourself.
Is anyone at higher risk?
Yes, definitely. The sources strongly advise that immunocompromised people need to be extra cautious.
Who does that include?
People like the very young, the elderly, individuals with chronic illnesses, or those receiving treatments that suppress the immune system, like chemotherapy or long-term steroid therapy. These individuals should be particularly diligent with hygiene and might want to discuss limiting very close contact, like letting the pet sleep in the bed, with a pet that has an active strep infection, at least until it's resolving with treatment. They should talk to their own doctor and their vet.
Good advice. Anything else for owners?
2 key things. Make sure you complete the entire course of antibiotics for your pet, even if they seem better partway through. Stopping early can lead to recurrence or resistance.
Right. Don't stop just because they look better.
Exactly. And secondly, owners should be vigilant. Monitor your pet for improvement, but also watch for any worsening signs. And, importantly, be aware of any new or unusual symptoms developing in people in the household, particularly if the pet has a severe or draining infection. If concerns arise, contact your physician.
What about preventing spread in places like shelters?
Yeah, for those high-density situations, strict hygiene and sanitation protocols are paramount. Reducing stress for the animals is also important, as stress impacts immunity. And critically, promptly identifying and isolating sick animals is key to preventing outbreaks, especially if things like that contagious S. zooepidemicus pneumonia.
Wow. We've really covered a lot of ground here, from these tiny, often harmless bacteria
Right, living as normal flora.
to becoming these opportunistic pathogens, causing this incredibly wide range of diseases, some mild, some terrifyingly severe.
It really highlights that delicate balance between the host, its microbiome, and factors that can disrupt it. Compromised immunity, broken skin barriers, underlying illness, these create the opportunity.
And diagnosis takes that careful veterinary workup, clinical signs, history, and those crucial lab tests like culture and sensitivity.
Yep, CNS guiding the antibiotic choice, which is often those reliable beta-lactams like penicillin or cephalexins, alongside vital supportive care.
Prognosis varies wildly. Good for many localized cases, but pretty grim for the really invasive stuff like necrotizing fasciitis or STSS.
And that emerging understanding of S. canis as potentially zoonotic is a crucial reminder. Not something to panic about, but something to be aware of, reinforcing the importance of basic hygiene, especially around sick pets.
It really makes you think. So here's a final thought for you to consider, building on all this. How does this seemingly stable relationship between a pet and its normal bacteria suddenly fracture? What specific combination of factors to pet's health, maybe subtle environmental changes, the specific strain of bacteria tips that balance towards severe invasive disease? And what does this evolving story, especially with S. canis bridging the gap to human health, tell us about the intricate shared microbial world we occupy alongside our animal companions?
Definitely gives you something to mull over. The complexity is just fascinating.
It really is. Well, thank you for helping us navigate through all these sources today. Really insightful, deep dive.